Focal segmental glomerulosclerosis, Wikipedia audio. Focal segmental glomerulosclerosis is a cause of nephrotic syndrome in children and adolescents, as well as a leading cause of kidney failure in adults. It is also known as focal glomerular sclerosis or focal nodular glomerulosclerosis. It accounts for about a sixth of the cases of nephrotic syndrome. Is by far the most common cause of nephrotic syndrome in children. MCD and primary FSGS may have a similar cause. The individual components of the name refer to the appearance of the kidney tissue on biopsy. Focal only some of the glomeruli are involved. Segmental only part of each glomerulus is involved. Glomerulosclerosis refers to scarring of the glomerulus. The glomerulosclerosis is usually indicated by heavy PA staining and findings of immunoglobulin M and C3 convertase in the sclerotic segment. Depending on the cause, it is broadly classified as appearance. There are many other classification schemes also. 5 mutually exclusive variants of focal segmental glomerulosclerosis may be distinguished by the pathologic findings seen on renal biopsy. Primary, when no underlying cause is found, usually presents as nephrotic syndrome. Secondary, when an underlying cause is identified, usually presents with kidney failure and proteinuria. This is actually a heterogeneous group including numerous causes such as toxins and drugs such as heroin and pamidronate, familial forms, secondary to nephron loss and hyperfiltration, such as with chronic pyelonephritis and reflux, morbid obesity, diabetes mellitus. Recognition of these variants may have prognostic value in individuals with primary focal segmental glomerulosclerosis. The collapsing variant is associated with higher rate of progression to end-stage renal disease, whereas glomerular tip lesion variant has a low rate of progression to end-stage renal disease in most patients. Cellular variant shows similar clinical presentation to collapsing and glomerular tip variant but has intermediate outcomes between these two variants. However, because collapsing and glomerular tip variant show overlapping pathologic features with cellular variant, this intermediate difference in clinical outcomes may reflect a sampling bias in cases of cellular focal segmental glomerulosclerosis. The prognostic significance of perihilar and NOS variants has not yet been determined. The NOS variant is the most common subtype. Collapsing variant is the most common type of glomerulopathy caused by HIV infection. Some general secondary causes are listed below. Focal segmental glomerulosclerosis may develop following acquired loss of nephrons from reflux nephropathy. Proteinuria is non-selective in most cases and may be in subnephrotic range or nephritic range. There are currently several known genetic causes of the hereditary forms of FSGS. Some researchers found SOPAR as a cause of FSGS. Glomerular hypertrophy/hyperfiltration, unilateral renal agenesis, morbid obesity. Another gene that has been associated with this syndrome is the COL4A5 gene. In children and some adults, FSGS presents as a nephrotic syndrome, which is characterized by edema, hypoalbuminemia, hyperlipidemia, and hypertension. In adults, it may also present as kidney failure and proteinuria, without a full-blown nephrotic syndrome. Classification. Pathologic variants. Causes. Genetic causes. Diagnosis. Symptoms and signs. Tests. Differential diagnosis. Treatment. Notable patients.